Hi folks, I'm Dr. Ed Beyer. Today we're discussing the 22 ways in the scientific literature that thyroid expression can be low. There are 22 ways that we can develop hypothyroidism. And it's very frustrating because I have a clinic full of people or new patients that come to see me. They watch my videos and they realize they've been going to their endocrinologist or medical doctor, and they're not looking at any of these 22 ways. They look at one of them. They look at TSH and T4, and they're going to adjust the hormone replacement, Thyroid usually, or levothyroxine, depending on what those markers show in the blood work. That is a woefully inept way of managing the thyroid because there are so many different ways that it can be low. Now, I want to talk about number 19, and my number 19, 20, 21, and 22 are all basically the same thing. The hormone cannot get into the cell. So the active form of thyroid hormone is T3, not T4. And levothyroxine and Synthroid are T4, it's not T3. It's got to get converted over, and we discussed all the things that can inhibit that on other videos. But there are 4 ways that we can have enough T3, but it's not getting into the cell. And what T3 does, it goes into our cells, and it attaches itself to our genes, to our nucleus, and it turns genes on and off all day long, monitoring our metabolism, making new genes, making new proteins and enzymes and things of that nature. It's a very important hormone. All of our cells need it. But if it can't get into the cells, then all bets are off. And these last 4, number 19 being one of them, thyroid resistance due to elevated cytokines. Now, cytokines are chemicals of inflammation. So when we are systemically inflamed or when we have whole body inflammation, these cytokines, these chemicals of inflammation are elevated. And these chemicals block T3 from getting into the cells. And this is really tricky because T3 and the blood work can look really good. And all the levels can look really, really good. But if that marker, if the T3 is not getting into the cell, it doesn't matter how high the level is. It's got to get into the cell. It's like having a lot of money, but you can't spend it. So this is a really important and tricky one that even doctors who practice functional medicine miss. So one of the things we'll do for all of our thyroid patients is really address systemic inflammation. So this is a tricky one. Now, what causes systemic inflammation? Well, the standard American diet is just super inflammatory. Too much sugar, too many carbs. We eat too much bad oils, which really trigger a lot of inflammation. Caffeine, alcohol, all these things, food sensitivities, hidden infections, leaky gut syndrome, the breakdown between the barrier of the inside of our gut and the inside of our body, allowing larger than normal molecules to get into our bloodstream, causing cascades of inflammation, are very, very common, ubiquitous in our society today. Autoimmune disease, insulin surges, poor blood sugar is extremely inflammatory. If someone's on insulin, and I know that many people need to be on it to monitor their diabetes, but that's extremely inflammatory. All of this will cause cytokine elevation, and it prevents T3, the active form of thyroid, from getting into our cells. So proper testing is the key. So long story short, if someone's suffering from a thyroid condition and they're systemically inflamed, they can take all the hormone replacement in the world, but until they get inflammation under control, they're never going to have good levels of thyroid activity. I'm Dr. Ed Beyer. I hope that helps. Have a great day.